recorded, and they can be found on our YouTube page. So welcome everyone to our annual meeting. My name is Kara Kaikini, and I use she, her, hers pronouns, and I am the newly hired Executive Director of the Maine State Breastfeeding Coalition. And I will share more about that later on. First, I would like to acknowledge that here in Freeport, Maine, I am standing on Wabanaki and Abenaki territories. And if you are interested in learning more about the Indigenous territory that you may be standing on, you can check out this website, native-land.ca. And I also want to recognize that it is Maternal Mental Health Awareness Week. And you can find out more about that, about maternal mental health and resources at the Blue Dot Project and also Postpartum Support International. So here is our plan for today. First, we'll start off with a year-to-date update, and we'll share what we are doing, who we are, what we're up to, and also do some committee reports. We'll also share some leadership updates, and then, like I said, we will wrap up with questions and our new knowledge worth sharing or connecting the dots portion of the meeting. So who are we? You may already be familiar with us, but if not, the Maine State Breastfeeding Coalition is a nonprofit that became established as a 501c3 back in 2017. We have a board of 9 incredible leaders. And our vision is that when every baby receives human milk, we will be a healthier Maine. And our mission is that we are welcoming and broad network of people supporting families who value human milk and breastfeeding. And together we work to enhance the culture of breastfeeding and chest feeding around the state through advocacy, education, and connection. And so we made some slight changes to that mission statement last year and are feeling really happy with it. We rolled out our 5-year strategic plan last year, actually 2021, which is focused on connecting, support, educating, and advocating and sustaining. And in order to achieve this plan, we did set up a number of committees, which are comprised of over 20 volunteers, and we'll share more about that later as well. So the first part of our strategic plan is connect. And our communications and DEI committees fall under this category. And one way that we're meeting our mission and our connecting part of our strategic plan is through our bi-monthly Connecting the Dots meetings, where we have a short board update and then spend the remaining hour connecting the dots. So that's a time to share what's happening legislatively that could impact work and families. What's going on in Maine that's worth knowing about, any new research ideas, and it's an opportunity to share any challenges that you might be having in your workplace that other participants could help with. So this is a really valuable part of what the MSBC is, what we offer, how we support one another, and we are looking forward to that time at the end of this meeting to do what we can with that in the time that we have. But know that it happens every other month. And all of our meetings, if you're not able to attend, are recorded and on our YouTube page. So fair warning, this is one of many QR codes in the upcoming slides. So you might want to have your phone ready if you'd like to use QR codes. Petricor will also be dropping in links into the chat if you would prefer to use the links that way. So the MSBC is regularly collaborating and involved with other organizations throughout the state and the country. We are members of the United States Breastfeeding Committee. We are on the Perinatal Quality Collaborative for Maine Steering Committee, as well as the subcommittee that is focused on providing guidance regarding diversity, equity, inclusion, and belonging. We're part of the Maine Paid Leave Coalition and part of their organizing subcommittee. You see a lot of that information in our newsletters and our social media, and we should be getting more updates any minute now about the legislation, an actual LD number and a public hearing coming up, hopefully for paid leave. And we are getting connected in with the Maine Prevention Network, which is a new group of public health districts that have received funding to work on different areas like healthy eating and active living, which includes breastfeeding. We've also sent in several letters of support for different organizations applying for grants. CHAMPS, you may have heard of, is the Communities and Hospitals Advancing Maternity Practices organization. We were asked by the Center for Health Equity Education and Research, or otherwise known as CHEER, and the Boston University School of Medicine and Boston Medical Center to support their grant application for CHAMPS. We're also included in the main CDC SPAN grant application and hope to hear some good news this summer about that. And we've supported the City of Portland Public Health REACH grant application. Fingers are crossed on that one as well. And the Mother's Milk Bank Northeast Davis grant efforts. So these partnerships are crucial to the work that we do, and we look forward to making even more in this next year. Our presence has significantly grown over the past years. Our meeting attendance averages around 20 people, which is up from about 15 people in 2018. We have 465 email subscribers, which is up from 360 just last year. So a lot of growth there. We're excited to have more folks in our mailing list loop. And we utilize that to send out advocacy updates, new resources, and so on. If you're not getting our emails, feel free to put your email address in our chat box and we can add you, or you'll find the link on our website to sign up. On social media, thanks to our gracious volunteer, Grace Cook, who I believe is here. I think I saw her join. Hi, Grace. Thank you for being here. And thank you for all of your work on our social media. That it is almost a full-time job keeping up with social media. It's such an important way to communicate what we do and to increase our visibility and our presence. So we now have over 1,100 Facebook followers, which is really exciting. Grace mentioned a few months ago that we had a Facebook reach of over 15,000, and that is defined as the number of people who saw any information about the MSBC on our account. We have 862 Instagram followers, which is up from 363 last year. Our website gets around 500 to 1,000 visits a month, and we're regularly updating it. In fact, our resources section was updated and finalized this morning by our web designer, Laura Fox. So thank you, Laura, for that support. Hopefully our resources section will be a lot easier to navigate. And we're still working on it. So we're still updating it, adding things, maybe changing some descriptions, that sort of thing. And Robin is the chair of our communications committee. So Robin will share now a little update about the communications work. And you're muted still, Robin. I might be able to unmute you. I can ask you to unmute. I can hit that button.
Mute, sorry.
There you are. Okay.
Thank you for unmuting me, Cara. I'll just make a few brief points. I really appreciate the slide that you made, Cara, that shows how much the social media has grown and made a difference. And I appreciate what Grace has been doing to keep it up. There's also the fact that Grace worked with some other people on this in the board do have a similar look, the font and the colors. So we have a kind of branding and people start recognizing the Breastfeeding Coalition. We have blogs every month and they have a picture and a new text, and doing something like that, updating your website like that every month or so helps keep us at the top of a search engine. So it's good information, but it also keeps us more current in search engines. And the last thing I want to say is I also started compiling a list of local newspapers because sometimes people are not aware of breastfeeding, but there are interesting events they should know about. For example, Ali Tozier's talk about employment. So employers who aren't into breastfeeding but need to know about the new law for pumping should know about that. So I'm collecting addresses of local newspapers, and I'll put occasional meeting events, things that are relevant for the general public in there as well. So ye old newspaper is still got some value. And our last blog was thank you for our sponsor, Dirigo Pediatric Dentistry. And we'll have another one from Soft Corner Midwifery and another one, Healthy Acadia. We offer that as a benefit of being a sponsor, and those were the three who took up on it. So you could promote that if you want to get more people to sponsor, let them know. They'll get a little blog post as well as many other promotions. So that's my report. Thank you, Kara.
Thank you, Robin, so much for your leadership with this group as well.
Sure.
Awesome. And Petricor, you are up next.
Hi, everyone. If you hear children in the background, I apologize. So I am the Diversity, Equity, Inclusion, Justice, and Belonging Committee Chair. And I just have a couple quotes for you to start off. The first one by Maisha T. Hill is, "We all have the opportunity to heal from the systems that have ravaged our human history if we're willing to do the work." Maisha does a lot of work. She has a large following on Instagram. Her page is Check Your Privilege. She does workshops. And the book that she wrote, Heal Your Way Forward, is one that we're actually reading right now as a committee. And then the next quote is from Audre Lorde. "In our work and in our living, we must recognize that difference is a reason for celebration and growth rather than a reason for destruction." So I really liked those two to kind of describe the work we're doing. Nope.
There we go. Sorry.
So on this committee is myself, Carrie Louch, Hannah Lord, Kara, and Fiona. And we got a lot of work done last year, and we have a lot more planned in the year coming up. We would love to have more people join us in this work who have a passion for DEI-JB. Our meetings are the third Friday of every month at 2. And if you'd like to join or have any questions, either about the committee or just DEI in general, you're always free to email me at my email address there. Last year, we completed the demographic survey, which some of you may remember filling out. We created the MSBC DEI-JB inclusivity statement and policy, both of which are on our website. I created an introductory DEI-JB webinar, which you can find on our YouTube channel if you'd like to watch it. It just kind of goes over the basics of DEI-JB and how they relate to lactation. And we have a whole DEI resource list on the website as well. So I believe that that should be up, and you can look at that as you would like. Our goals for 2023, obviously we want to continue developing an action plan to work on our strategic plan goals that relate to DEI, which includes things like creating a more diverse board and a more diverse general membership, and also reaching more diverse communities in Maine. We would really like to start a coalition-wide DEI-JB book club. We actually sent out a form last year and didn't get many responses, but if you would be interested in that, you can feel free to email me. We would really love to get that up and running, where we pick a book to read and we discuss it. We have an idea of co-sponsoring parent support groups in diverse communities throughout Maine to try to reach more people, more diverse communities. So a plan for that is in the works. We started raising money for the Lactation Education Access Scholarship Program that MSBC is going to put together. That scholarship will be for, in particular, marginalized communities to be able to put that money towards IBCLC materials, the IBCLC test, or CLC programs. So that's something that I'm really excited about. And then we are also going to be empowering parents and professionals with the United States Breastfeeding Committee First Food Experiences Survey. It hasn't 100% rolled out yet. It is something we are partners with USBC on, but what it does is it's a survey that's sent out to parents. They complete it and they can see their data compared to other parents' data in real time. So it shows early breastfeeding, chest feeding experiences in real time throughout the nation. So it's a really cool project and one I'm excited about. The other thing that's not on here, because of all the work that MSBC has done in DEI-JB, I have been asked to speak at the USBC National Breastfeeding Conference and Convening this year in June. I'll be part of a panel speaking about how to transform organizations through DEI. So thank you, Kara.
Thank you. I'm really excited about that, and we'll be reporting back as we can. All right, thank you so much. We also have our events committee, which is also under our connecting part of our strategic plan. And we have a small group of dedicated members who we are very appreciative offering their time every month or twice a month sometimes. Events have also been supported by other volunteers like Petra Kaur and Brooke and more. This committee is especially busy and especially fun and rewarding. So for anyone who is interested in joining a committee, please let us know. This one is especially fun, like I said. So we have been busy with, a year ago, we did our second Patchwork of Parenthood storytelling event. And in August, we focused on the World Breastfeeding Week webinars. In October, we helped to sponsor the No One Told Me documentary, their world premiere that was in Rockport. And we have our next Patchwork of Parenthood event coming up. So those are some photos from our 2022 Patchwork of Parenthood event. It was our first one at One Longfellow Square, and it was a success thanks to the incredible storytellers and the event volunteers who made it all happen. These were our webinars that we offered last year, and we're still in the process of planning this year's World Breastfeeding Week events and efforts. So if you're interested in being part of that planning, or if you have any ideas, let us know. And as always, if your organization is doing something to celebrate World Breastfeeding Week, we're happy to support that and share it too. This was the poster for the film last fall. And they have another screening in Portland. A lot of people have been wanting to see it. It is a fantastic film. It happens to be on the same day as our storytelling event, but there's time to go see this film from 3 to 5 p.m. And then that evening, make it over to One Longfellow Square to see the storytelling event, which is, tickets are available now. We're really, really, really excited about this event. These photos are of our storytellers this year. That's a QR code you can scan, or you can also go to our website to find out more about the storytellers and to get a link to the tickets. And so we are really excited about that. We hope to see you there. I think I might have to mute someone. A couple folks who might need, okay, thanks for and speaking of Brooke, Brooke has really worked hard to pull together this list of raffle prizes and to set up this raffle, which includes purchasing tickets through our Venmo account. And thank you to others like Miriam and Nina who have helped to solicit some of these raffle items. So you can see pictures of those items and more info on our Facebook page and on our Instagram page, and buy those tickets through Venmo. So we've had quite a few tickets purchased already. We're really excited about it. There are a lot of prizes, and you can choose which one you would like to put your name in for. You want to make sure that's clear when you buy the ticket on Venmo. Or you can choose to have your tickets go randomly in any of the buckets. So thank you for helping with our fundraiser here. And support and educate is the next part of our strategic plan. I think that Robin already mentioned the last webinar we had, which was Allie Tozier, attorney Allie Tozier. She did a fantastic job. We also, last year, we had a webinar on infant sleep and breastfeeding. We had a tongue tie panel during World Breastfeeding Week, which was really interesting. And we also had Dr. Rachel Criswell, who is on our board, speak about PFAS and other persistent environmental toxicants in the human milk. All of these webinars are recorded and on our website as well. Lots of great topics that we've had, and we have a couple that are planned for this year. June 1st, coming right up, Dr. Jessica Rosenthal, also a member of our board, will be speaking about breastfeeding and human milk and the microbiome. I know she's been doing a lot of research on this, and I think this is going to be really interesting. August 3rd, we will have Dr. Julia Fritz and Virginia Weil speak about feeding challenges in infants and understanding from a, oh gosh, I know Virginia Weil is a speech language pathologist, and Dr. Julia Fritz is a gastroenterologist, if I'm remembering correctly. So I've seen them speak on this topic, and I think it'll be a great webinar for us to host as well. And up next is Amanda to speak about Workplace Support Committee.
Hello. So for the Workplace Support Committee, you can see everyone listed there. And the things that we've been focusing on are Workplace Toolkit. So this is an electronic document to support parents that are going back to work and want to have tools and like talking points to talk to their employers about pumping or providing breast/chest milk at work. And then, so we're working on that. It's been a journey because there's so much information that we want to put in it, but we know that we want to make the toolkit, you know, shorter, so it's really accessible for people. So, you know, more coming on that, but we've made a lot of progress with it. And then we're updating the content on our website also around these resources. So our goals for this year will be to complete the Workplace Toolkit, update the website, like I said, and then in the future, we would love to create a business recognition/award program for businesses that are very supportive for parents going back to work. So yeah, so exciting things coming ahead.
Awesome. Thank you, Amanda. And I recently had some conversation with Ashley Edmondson from Let's Go, and I believe we'll be working closer with them on the development of that toolkit, and really excited about that partnership. So stay tuned and let us know if you want to be part of it. Advocate is the next part of our strategic plan, and we have an advocacy committee that is also comprised of some dedicated members, volunteers. We have been involved in the donor milk reimbursement legislation that passed last year. They're building the program to make it accessible for folks. So that involves working with the hospitals, working with the milk bank, and making sure that there are more dispensaries around the state where people can get that milk and have it easily reimbursed through main care. So the program and the system around that is still being developed, and we're a part of that process. I don't know if anyone is here from the Mother's Milk Bank, but maybe that you might have some updates for us in the second part of the meeting. I already mentioned paid leave for Maine. We are a part of that group, and we are doing lots of advocacy, writing letters to the editor, submitting testimony when that comes up in the next couple of weeks. And just spreading the word about it and helping to provide some education around it. The main doula steering committee is new, and that's something that we've been participating in as well. And we've also sent in public testimony to support a few different pieces of legislation. One that would maintain main care reimbursement of breast pumps. And I believe that was divided in the committee. So we'll see what ends up happening with that. As well as legislation that would eliminate sales tax on prescribed medical equipment like breast pumps. And we're also in communication with the bill sponsor for a bill that was carried over to next session about private insurance coverage for donor breast milk. So we plan on staying in touch with folks about all of those, and also keep a close eye next year on related legislation for next session, because if you follow any of this, you know that there's so much that happens here, and there's so many bills that are proposed, and there's a lot of activity this time of year. So we want to try to get ahead of that a bit more next year. But that committee is also welcoming new members. If you were interested in being part of this, we're happy to welcome you. We also created this guide to requesting insurance coverage for donor human milk. And you can find that. It's a Google Doc. You can scan that QR code, or I believe Petrichor has a link that they can drop in the chat box as well. And this just offers folks, you know, if they may have insurance that covers donor milk, or they may not know. And so it leads you through the process of making that phone call to your insurance company and asking about it. What kind of numbers do you need to give them? What information would be helpful for them to answer the question? And also, I feel like the more people that are asking for it, it might be more likely that insurance companies will cover it before there may be legislation. We also recently offered this action hour around paid leave. We worked together with Maine Family Planning, Mabel Wadsworth, Planned Parenthood, and Restore the Floor, as well as the Maine Women's Lobby on that. And I mentioned this public hearing will be coming up. You can testify in person. You can testify by Zoom. You can also just send in written testimony. And as we've said before, it can be intimidating to do this, but we are here to help. And the Paid Leave Coalition has created some fantastic resources and guidance around paid leave. So if you are interested in submitting testimony, again, either in person or Zoom or in writing, just sending it to the committee, let me know. Either drop something in the chat box, send me a message at mainebreastfeeds@gmail.com. and I can pass on those resources to you. There's a really strong team that can help you with that. But we need as many people as possible to tell the legislators and these committee members why this is critical to Maine's families and businesses, and the details around that policy. Once we know what the actual legislation is, once that's finally, the writing is finalized, we'll know what pieces we might want to support in particular around how it is structured. So let me know if you are interested in that. I'm also going to be facilitating a panel next week at the Best Connection Conference that is related to advocacy. So the title of this panel is The Impact of Policy on the Lactating Family. And you can still register for that conference, I think up until May 9th. You can go to the website or to use that QR code. And even if you can't attend live, there are recorded sessions that will be available on Thursday, and then the actual live sessions are on Friday, and they'll be available for viewing until June 12th. So even if you can't make it those days, you can watch the recordings. It is from 10:15 to 11:45 that day. I'll be giving handouts that will review the different 10 different policies and laws that impact the lactating family, that range from FMLA and paid leave, the PUMP Act, to workplace policies and hospital policies. A lot of that information is on our website as well. And then I'll be sharing in ways for folks to get involved. So these are some resources that I imagine we'll have available on our website as well, but we hope that you can join us for that session. And then the last part of our strategic plan is sustain. And Brooke Barron is our fantastic treasurer who will give a financial update. Brooke, are you there?
I am there. Can you hear me?
Yes.
Great. I'm going to go camera off because my internet has been very unstable this morning, but I'm here.
Okay.
Thanks, Kara. So this has been my first full year as treasurer. It's been a time of real excitement and growth. Looking back to the past 2 years, top line revenues increased from almost $2,900 in 2021 to over $31,000 in 2022. That was thanks to 2 grants we received and the launch of the partnership program, which we'll be discussing more in a few slides. We had moderately successful ticket sales and raffle sales, which offset the high cost of holding events. If you compare the ticket sales and raffle sales to the event expenses, you'll see that we just about broke even there. As Kara mentioned, after 2 years of pandemic-related hiatus, it was so nice to have Patchwork of Parenthood in person, as well as hosting documentary screening in Rockland. I think that these events are important community building opportunities that expand our reach, and we hope that they can become revenue generators. But last year, they would not have raised funds for us without the support of the event sponsors and the participants in the annual partnership program. So the really dramatic increase in revenue that you can see also allowed us to offer speaker stipends for our meetings last year. They were leading to lots of new opportunities for us. The major expense was the subcontract of grants. So we paid individuals for their work to carry out the grants that we received. We also devoted a significant amount of our budget, over $2,600, to the website redesign. That was an investment in a modern, user-friendly interface that expands our reach further. Some of the private contributions you see listed in green, those were received through our Giving Tuesday campaign that Petrichor mentioned. So those are earmarked for our Lactation Education Access Scholarship. for members of underrepresented and marginalized communities. We began this fiscal year in January 2023 with over $23,000 in our account. Our revenue thus far this year has been from private contributions, as well as event advertising from WIC, and our expenses have been related to website hosting, speaker stipends, and planned travel to and participation in the MSBC conference in Washington, D.C. So as a board, we recently voted to devote a significant amount of our outstanding funds to hire a part-time executive director at 15 hours a week. We're so fortunate to have hired Kara in this role. We do remain a volunteer-driven nonprofit with a very small budget, despite the relative growth we've seen over the past 2 years. I'm really proud of that growth that's been cultivated through our hard work. And as a board, we felt confident in our financial stability to be able to pursue our first ever hire for a year-long contract. It's important to note the long-term sustainability of this hiring decision will depend on the success of our partnership program and successful grant applications this year and in the future. That is all I have, and I'm happy to answer any questions.
Thank you so much, Brooke. I really appreciate that report and the careful tracking of all of this. It gets a little more complicated and exciting every year.
Yes, it does.
Any questions, feel free to drop in the chat and we can be sure to answer those at the end. So we mentioned the Giving Tuesday fundraising campaign. That was super easy to do, and we encourage anyone to do this. It doesn't have to be on Giving Tuesday necessarily, but if you are on Facebook, you can do an easy fundraising campaign. A lot of people do it for their birthdays. We would be happy to be the beneficiary of your fundraising campaign through Facebook, and can answer any questions that you have around that. We can also help you plan your own creative fundraising event. It could be a private dinner party, or you could also help set up a reoccurring giving or donation program within your family or your place of work. So there are lots of opportunities to raise funds to help us keep going. And thank you for any support you can offer. In terms of that partnership program, we will be rolling this out. We'll be launching our second patron partnership program in the next month or so, and that will help us to expand our work, continue resource development and communications, educational opportunities, and the legislative work that we talked about to help improve vital policy and also overall operations. So if you know of any businesses who might want to support us and who might also want us to help them increase their visibility to our audience, then let us know. So thank you to our patron partners. We have other sponsors as well, but we recognize our patron partners during these meetings and are very, very grateful for their support. And another hugely valuable way to give and support our mission is through volunteering your time. So you can learn more about our committees by scanning that QR code or going to our website. Another one that we didn't mention because it's still to be developed and the board needs to approve of this is creating a professional education committee that will be focused on our webinars and maybe potentially someday a bigger educational opportunity like a conference. And other educational opportunities that we're always sharing out with folks. So if you're interested in that, which I have a feeling a number of you here are interested in professional development and education, that's why you are here or part of the MSBC, then let us know. And you can sign up to be a volunteer by scanning that QR code, going to the link, and you can select what area you are most interested in. And we want to thank you. We want to thank all of our volunteers who have been so helpful this past year and longer. So in that middle column, those are our board members. They're all volunteers who have dedicated a lot of time to getting us to where we are. And we have our committee volunteers here as well. So thank you, thank you, thank you. And another way to volunteer, again, is through our board of directors, where we are focused on overall leadership of the nonprofit, fundraising, strategy, and teamwork. It's a fun group of folks to be a part of, and we would love to hear if you're interested. So feel free to share that. That is on our website, and I do believe that Petrocor will share that link too. We're specifically looking for folks who have an interest in this work, which I think is everyone here, but especially if you have experience in nonprofit development or resource development, grant writing, fundraising, any of that, or just you consider yourself a leader, we would be happy to talk with you more. And speaking of leadership updates, so as we already mentioned, I'm excited to be the first executive director of MSBC as a part-time contracted position this year. And creating this position was part of our strategic plan that we have been talking about for a while. The board has worked really hard to get us here. So thank you to our board of directors for your work on this and for your confidence in offering me the role. I will be focused on supporting and coordinating the initiatives throughout the state that align with our strategic plan. We'll provide overall direction on policy strategy and work closely with the board of directors and volunteers. And I'll be managing the day-to-day operations, building our position as a leader in lactation and new parenting in Maine. So I'll be collaborating and responsible for administrative and fiscal management and public relations, and we'll continue a close working relationship with the board and any future staff. So thank you all for your support in this new role. And now I want to spend a moment to thank 3 fantastic board members who are transitioning off our board after years of dedicated service. Nicole was integral in creating our strategic plan 2 years ago and developing our workplace support content that's on our website and will be in our future toolkit. Her vision and direction and experience in strategic planning brought us to where we are now, and we are so happy to support her as a mom of 3 now and as a business owner of Maine Mother and Company. We're sad to see Jenna move out of state, but trust that we'll stay connected. Her expertise in communications has been hugely helpful, and we will miss her. Her business remedy, family sleep and stress management is still a fantastic resource, even all the way over in Massachusetts. So if you know anyone who can use that support, she's still available for that. And Amanda has been part of our leadership team for the last 4 years. She joined in 2019 when we were really starting to grow, and her dedication has been such a strong component to that growth. She's participated in nearly every aspect of our organization and committees and has been a significant part of bringing us to where we are today. Her participation on our board will be missed after June 1st, but we know we'll stay connected. So thank you, Amanda and Nicole and Jenna. You can see all of these wonderful board members at our Patchwork of Parenthood event next week. I believe they will all be in attendance, so you can thank them in person for their commitment and hard work and wish them luck, and maybe give them all some hearts right now too, if you can. And then that brings me to some new board officer announcements. So as a result of these changes, we're excited to announce new board officers. Petrocor will be stepping into the president role, and Nina will be stepping into the vice president role. And I'm really excited to see where we go from here as our leadership gets a new boost. I believe that with change comes great opportunity. So I'm excited to see what comes next. So it's a lot of information in 40 minutes, but if you could share what you are excited about based on all that information, in what ways are you excited to see the MSBC support you and the families you work with? What might you be interested in working on? If you can go to menti.com or scan that QR code, and I'll see if I can bring us to that page. And then we'll come back for connecting the dots. So give me one moment here. This is this is new for me. So I am hoping to, oops, that's not what I want. Let's see. Oh, view results. Here we go. Here we go. Any minute now. Is anyone having issues with this? Oh, here we go. For real, I believe. Bear with me. It's loading. Here we go. Okay, I'm going to share my screen. Okay, so you are excited about workplace development, resources, connection, Maine leave. I believe that's Maine paid leave, childcare. Yeah, there's definitely opportunities for childcare. And I did connect in with the Maine Education for Early Childhood, and we're going to talk more this summer. Our future, policy, partnership, and momentum. Oops. Excellent. Thank you so much for participating. And now I'm going to stop sharing my screen and we're going to move into our next part of our, hold on one second, and I'm going to bring us back to our slide that will tell us where we're going next. So connecting the dots part of the meeting, we've got about 17 minutes to share what's going on in Maine that you would like to share with us. Any challenges you might be having, any legislative updates on your end, any new research ideas. If we can go around, I think what I'll do is go down the list. Well, actually, since we have a limited amount of time, if you would like to go, please raise your hand and I'll call on you. Otherwise, I'll just randomly call on folks. Okay, so I'm going to stop sharing now. And this is a great opportunity to turn on your camera if you could, so that we can all truly feel like we are connected here. So I see Christine's hand is up. Christine, go for it.
Hi, everybody. Christine, I'm lactation consultant in Southern Maine, Scarborough area. I just started a new group for breastfeeding support for new parents. It is a paid group, but we're trying to do like a really minimal fee of $12 just to hold the space. And that's Friday from 10 to 11 at Root to Rise, which is a pelvic floor physical therapy studio in Scarborough. So we're just starting that every Friday and hoping to kind of stir up, like meet that need of support for parents. It's not exclusive to breastfeeding, just, but we're supporting that there also.
Awesome. Thanks, Christine. Who else has something you'd like to share? I know I see some folks. Oh, Robin, go ahead.
Am I muted?
No, now you are.
Yeah, okay. I thought that the employment webinar was very helpful, and I'm just wondering if that would be repeated. I know people can see it through YouTube, but I wonder if we could do a repeat performance of that. That's one question. My other question is, I think you answered it. I was interested in reimbursement, how that's going with pasteurized donor human milk, and how close are we to getting that done, and what do we need to help facilitate that?
Great questions. So your first question about the webinar, I think it's definitely something we can repeat, especially once we have more workplace resources ready. I think there's a lot of opportunity, and Attorney Tozier is really excited to help with that and to connect with more employers on what their role is in all of this. So I think that there's some great opportunity coming up for that. And your next question about donor milk, is anyone here from the Mother's Milk Bank by any chance? Looking through the list real quick. Okay, so the bill did pass, and MaineCare is instructed to reimburse for donor breast milk. What I mentioned before is that the system is not super clear on how to go about that. So I think that one option is if someone needs donor breast milk and they are a patient at a hospital that might already use it, that is the first step. So that's the first step that the Mother's Milk Bank and the Office of MaineCare is working on with the hospitals who already have dispensaries or already have donor milk in their hospital, to make sure that that system is clearly in place for folks to go back and get that breast milk reimbursed if they need it once they're home. And then next steps after that will hopefully be connecting with other dispensaries in the state who might already be in place, or help develop other dispensaries in the state. And so that might be one way you can help, is talk to local pediatrician offices, family doctor offices, midwife offices, and ask them if they're interested in opening a dispensary. And then the next step after that, if they were to open one, would be connecting them in with MaineCare as a provider. And those are the pieces that I'm not super clear on, but they will get sorted out. Thank you for asking that, Robin. What else? Katie Reed, I see you're here. I'll put you on the spot. I don't know if you have anything new to update on paid leave. Would you like to introduce yourself? And
yeah, I can. I wanted to give the opportunity for other folks to share. But I'm Katie Reed, and I'm the Paid Leave Coalition Coordinator. So I work closely with Kara as she represents the Maine State Breastfeeding Coalition at the on the Paid Leave Coalition. And like Kara said, we do not have a date for a public hearing for a paid leave bill just yet, but we anticipate that it will be coming soon, mid to end of May. And we would love to have folks who support paid family and medical leave come share testimony and be able to participate in the events of that day. So please connect with Kara or myself to find out more, and we will keep you all posted, and I hope to see you there in person.
awesome. Thanks, Katie. Any questions for Katie about paid leave? She might be able to answer. You can type that in the chat box or send her a message.
I have a question.
Yeah.
Katie, I'm wondering, what do you feel are the most effective testimonies? I think we were talking about how the legislature really needs to hear about paid leave from businesses and small businesses. So would that be a major focus on the next time you have testimony?
Yeah, I think that can be a big focus. One thing that is important to know is so the coalition is made up primarily of advocacy organizations, and we have more than 35 partner organizations who can provide lots of information on the data behind paid family medical leave. So if you have your own personal paid leave story or lack of paid leave story, or how you've seen that impact individuals in your community, it also is needed to draw on your own personal experience. So that is something as well. But yes, we do hear the impact on small businesses as a point that people really want to pay attention to make sure it's affordable and accessible for them. I hope that answers the question.
Yeah, thanks. And again, if you're interested at all in participating in writing a letter to the editor or testifying, send a message to Katie. Katie, do you mind putting your email in the chat box? Because she can send you resources that we're not just sending out to just everyone, but if you have some interest, then there's some fantastic resources that can really guide you in writing. And I see Casey wrote from Southern Maine Healthcare, nothing specific to share other than being excited about the grant deliverables, including breastfeeding. So I do see a number of HEAL coordinators and Maine Prevention Network folks here. And so this might be a great opportunity. Alexis sharing from Maine Prevention Network in Cumberland County. And in this new infrastructure, just getting started, thinking about ways to offer education to decision makers using public health framing around the importance of breastfeeding. Another goal is working with municipalities and workplaces to support implementation of best practices to support breastfeeding. And we are also excited to partner with you all. So thanks for being here. Like I said, I'm recognizing a lot of names who are part of that work. And I'm wondering if there are any questions that you might have for everyone else here on the meeting who have been part of breastfeeding work. Anything that you might want to ask that might help guide your work. I know that I'm working closely with Dawn Littlefield-Gordon, who is helping to lead this work. So we're having a lot of conversations around what some drivers are to increase breastfeeding rates and experiences. But if this is an opportunity, and our future meetings will be opportunities with a little more time to share questions and ideas. Okay, great. And Penobscot and Piscataquis counties also going to be working with work sites and early childhood education sites. Yeah, I think that's a common area, and we are so excited to be working together and have partners in this work as it all gets a little more clear what that's going to look like. Yeah. Who else would like to share?
I guess if they could explain the grant that they just got, because I'm not familiar with grant, what the Healthy Maine Partnerships grant they received was.
Good question. Is there someone who feels like you can speak to that? So I think it used to be Healthy Maine Partnerships funding, and now it is Maine Prevention Network. Cassie, would you like to answer that?
Yeah, so it used to be the last 6 years was Maine Prevention Services, where the funding came from a different source. So now the funding is coming from the Maine CDC, specifically through different districts. So like us in York County, York District, have funding to do specific work with healthy eating, active living, and we develop a work plan for specifically. We have 3 different focus areas. So it'll be healthy eating, active living, and then supporting breastfeeding through work sites, healthcare systems, and then in the community. So I think through your coalition, we're looking to get kind of, at least from our experience in New York, we don't know a lot about what's out in the community and the data, how many families are breastfeeding, or so there's a lot. I think we're going to be looking, and it looks like you're working with Dawn Littlefield already at the CDC. So she can obviously work with her. You're going to get more of a state perspective, but locally in York District anyway, we're looking like to just find out as much information as we can to better support all those different sites. Hopefully that answered your question, Jennifer. As far as funding, it's really from the CDC, and then it funnels through the different systems. So specifically for us, it's Southern Maine Healthcare, Maine Health. So.
And Cassie and Jen, have you two met before? You're both in York.
Yeah, I think we have.
We have, yeah. And then I know Casey Marcotte also. So, and WIC we have some information on breastfeeding rates for our participants, and the state tracks that. The state tracks all of the breastfeeding rates, and we get notified on, and we have certain parameters that we're trying to meet with how many people initiate breastfeeding, and then the percentage of people that are breastfeeding or chest feeding after 6 months. So we do have like some of that data, but that would just be WIC specific data, not completely York County data.
Yeah, and we have WIC is definitely a list on the list of our collaborators as far as on our work plan. So we'll be definitely reaching out to this coalition as well as other partners in our district. So
great.
Thanks. And seeing other chat in the box, Audra. So Sandy Fortin, thanks for being here. I know you're also working on this. And Audra from Let's Go. Yes, I think we're going to have a great partnership on workforce tools. And Kathy, you sharing about Maine families home visiting all across the state. Absolutely. I feel like we often have great Maine families representation in our meetings. And so glad for that. You're doing great work. And Central District CDC is now Healthy Communities of the Capital Area, and Somerset Public Health are working together. Okay, thanks, Nan, for sharing that. And Sandy, tabling at early childhood education events and wanting to include breastfeeding materials. Yeah, it'd be great to have some sort of a starter package. So that is something, that is something we can definitely all talk more about. And I think there are opportunities here when we talk about our communications goals, maybe creating some sort of a statewide group, like we are a statewide group, but like a Google group, for instance, where we can be asking these questions and we can be sharing resources. I think that's definitely an opportunity. It's also easier I've learned to share Google Calendar invites to a large group of people if you have a Google group. And I know a lot of people like these meetings to already be on their calendars. So lots of opportunity here, and welcome your ideas. This is so great to see the energy behind this work. I also see some folks here from hospitals. I don't know if there are any updates from hospital sites or any questions for the group. Okay, Elon, thanks. I know I didn't want to call you out in particular, but she's got a sick kiddo and keeping camera and mic off. Yeah, thanks for being here though, Elon. I'm glad you're here. What else? See, Michelle is here from Cumberland County Opportunity Alliance and the WIC program there. Thank you, Michelle, for being here. You're welcome to share anything, but I just want to thank you for helping with posters for our Patchwork of Parenthood event. We don't have to stretch it to 1 o'clock if we don't have anything else to share. But thank you all so much for being here and hearing more about what we're up to. Thank you for your support and thank you for all the work that you're doing every day. Look forward to staying connected. Have a great rest of your day.
Thank you.
Thanks, Brooke.